Necrosis. Definition of necrosis is a localized area of death of tissue followed by degeneration of tissue by hydrolytic enzymes liberated from dead cells, accompanied by inflammatory reaction. Cause of necrosis includes hypoxia, chemical and physical agents, microbial agents, and immunological injury. Types of necrosis. There are 5 different types of necrosis. So we have coagulative necrosis, liquefaction necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. The first one is coagulative necrosis. It is the most common type of necrosis. It is caused due to irreversible focal injury due to sudden cessation of blood flow or bacterial or chemical agents. It occurs in all the tissues except the brain. Organs affected are the heart, kidneys, spleen, and adrenal glands. Gross. Necrosis is not apparent in the early stage. It appears pale, firm, and slightly swollen in case of coagulative necrosis. This is called infarct. Later, it becomes more yellowish, softer, and shrunken. Microscopy of coagulative necrosis. The normal cells are converted into tombstones, that is, the outline of cells are retained and the cell type can be recognized by cytoplasm and nucleus is lost. The cells are swollen and have more eosinophilic cytoplasm. The cells show nuclear changes of pycnosis, karyolysis. Eventually, the necrosed cells are infiltrated by inflammatory and dead cells. The second one is liquefaction or colliquative necrosis. It occurs due to ischemia and bacterial or fungal infection. The hydrolytic enzymes have a dominant role in causing the semi-fluid material. For example, brain infarct and abscess cavity. Grossly, the affected area is soft with liquefied center containing necrotic debris. Later, a cyst wall is formed. Microscopy. The cyst wall is formed by proliferating capillaries and inflammatory cells. The cyst space contains necrotic cell debris and macrophages filled with phagocytosed material. The third one is caseous necrosis. Caseous means cheese-like. It is a combination of coagulative and liquefactive necrosis which is seen in tuberculous infections. Grossly, the foci resemble dry cheese. It appears soft, granular, and is yellowish. Microscopy of caseous necrosis. The cells are not totally liquefied, nor the outlines are preserved. The center contains structureless eosinophilic having granular debris. The surrounding tissue shows granulomatous inflammatory reaction consisting epithelioid cells and giant Langerhans cells. The fourth one is fat necrosis. It occurs at fat-rich anatomic locations in the body. For example, traumatic fat necrosis of breast, especially in heavy and pendulous breast, mesenteric fat necrosis due to acute pancreatitis. In acute pancreatitis, the pancreatic lipases from injured or inflamed tissue liberates, resulting in necrosis of the pancreas. In fat necrosis, hydrolysis and rupture of adipocytes occur, releasing neutral fats which changes into glycerol and free fatty acids. These free fatty acids complex with calcium to form calcium soaps. Grossly, fat necrosis appears as yellowish white and firm deposits. The necrosed foci appears firmer and chalky white due to formation of calcium soaps. Microscopy. Formation of calcium soaps is identified as amorphous, granular, and basophilic material. Fibrinoid necrosis is characterized by deposition of fibrin-like material which has staining properties of fibrin. It is found in immunologic tissue injury, peptic ulcers, etc. Microscopy of fibrinoid necrosis. It appears eosinophilic, hyaline-like deposition. The necrotic focus is surrounded by nuclear debris of neutrophils. Local hemorrhage may occur due to rupture of blood vessel. The sixth one is gangrenous necrosis. It comprises of massive ischemic cell death and coagulative necrosis modified with decomposition by liquefactive putrefaction by saprophytic bacteria. It releases proteolytic enzymes and there is production of gases. Causes due to arrest of circulation, bacterial toxins, or physical agents, for example, trauma and frostbite. Types of gangrene. We have dry gangrene and wet gangrene. Dry gangrene affects limbs. It is usually seen due to arterial obstruction. Wet gangrene affects limbs and bowel. It occurs due to arterial and venous blood flow obstruction. Dry gangrene, denaturation and coagulation of protein dominates, whereas in wet gangrene, liquefactive necrosis dominates. In dry gangrene, the line of separation is formed at the point between the gangrenous and the viable part. In wet gangrene, there is no clear-cut line of demarcation between the gangrenous and the viable part. In dry gangrene, begins in the distal part of a limb due to ischemia, for example toes and feet, whereas wet gangrene occurs in moist tissues and organs, for example bowel, lung, mouth, cervix and vulva. Example of dry gangrene is Raynaud's disease and Berger's disease. Example of wet gangrene is diabetic foot and bed sores. The last one is gas gangrene, which is a special form of wet gangrene. Cause due to gas forming Clostridia, which is a gram-positive anaerobic bacteria. It gains entry into tissues and muscles through open contaminated wounds or colon operation complications which contains Clostridia.